this is Denise Mendenhall. I'm going to go over the electrolyte sodium today and talking about what sodium does to our patients and how do we see it in our patients and how do we take care of it in our patients that we have. So we have to always think about our electrolytes, and sodium's the big one. We have to think about our fluid compartments. And the three fluid compartments in our body are vascular, interstitial, and cellular. And where we find the majority of sodium in these compartments are these two. The vascular and interstitial is where we find the majority of sodium in our patient's body. And our serum levels that we will get in our labs show that it should be from 135 to 145. And if you compare that to all the other electrolytes, it is the largest range. And that's because sodium is the extracellular electrolyte that we find in our patients, so it has the highest concentration. But sodium is a little bit different in that we have to think about sodium as a concentration, not as a number by itself. It's in a concentration with water. And so water and sodium have to be considered together, because wherever sodium goes in outside of our cells, when we get it into our body, it pulls with it passively water. And so water has to be considered part of this value. What we worry about when we're talking about sodium range is when it starts to get outside of this range. And in order for you to get it outside of this range, you have to change the balance of this concentration. So in order for you to have an increase in sodium in your value that would be above 145, you either have to have a decrease in water or you have to have something that increases sodium. Examples of something that would decrease water in your patient's body might be dehydration. So a patient that becomes dehydrated, their sodium levels will artificially go too high. And if you have a patient, let's say, with a problem with the RAS system is into sequestering sodium, and so that could potentially raise the concentration as well. On the other side of the picture, with sodium being too low, you either have an increase in water that's diluting it, or you have a situation where you have a decrease in sodium. And things that may do that, increasing water, example would be SiADH, which you have an inappropriate secretion of antidiuretic hormone, and that causes your kidneys to retain water, which can cause a too far dilution. On the other side, we can have a problem here with the RAS system, where we have an anti, something that's against the RAS system, which would cause you to lose more sodium. Example, again, might be some of the drugs and things that we use. Or it could be, this is another disease called Addison's. They could have some problems with that as well. So we have to look at sodium as a ratio of water to sodium. And when you eat a big meal, somebody is eating a lot of sodium in their diet, they're not going to necessarily throw this out of balance, because remember that sodium passively, or water passively goes with sodium. So when patients have a problem with having too much sodium in their diet, they actually have a problem with volume, not necessarily changing the ratios here of your sodium. So let's talk about what the effects are on this patient's body when we're talking about sodium. All right, let's talk about what the effects are of sodium on the body when we're talking about it being hyper versus hyponatremia. And so when you have an increase in sodium, it could be for two reasons. You might have an increase in body fluids. Because you have an increase in sodium that may be pulling some water with it, to increase that. And then if you have an increase in body fluid, you're going to see an increase in weight as well. And that's one of the ways we can measure that. If you start increasing sodium, it's going to cause increased water. It's going to affect the heart. The heart's going to have a harder time pumping because there's more fluid now in the extracellular, which is going to be your vasculature, which plays into your heart. We also have to worry about the kidneys, and the kidneys can have to deal with that excess amount of fluid as well. The other scenario with having too much sodium could be because you have an increase in sodium, but you may have a decrease in water, such as they're dehydrated. And in this case, you won't necessarily have that increase in weight, even though the sodium is higher. And that won't have as much of effect here on the kidneys and the heart as it will as on the brain. And we're worried about the brain with a hyper scenario because what it does is it actually will suck water because the concentration's higher outside of the brain cells. It will suck water out of the cell and will actually dehydrate the brain cells. And there are symptoms that go with that dehydration effects on the brain. The brain can't tolerate that excess movement of water in and out and dehydration. So we have to be very, very careful when we're talking about the brain and sodium levels because of the effect of water within our cells. Okay? Remember that we do have a sodium-potassium pump on our cells, and it does pump sodium out, but it doesn't have that water. And if the sodium is excess outside, it's going to affect that water concentration. On the other side, when we have hypo, we usually have a problem with increased water. And in this case, we may have a problem with fluid excess. And this fluid excess can act again on causing symptoms on the heart. It can also make it hard for the kidneys to have to deal with that excess fluid and water to try to get rid of. Again, depending on the cause. But the other effect has to do with the brain. Again, in this case, there's too much water out here, not enough sodium. It's going to pull sodium out of the brain and to deal with that concentration. It's going to push water into the brain to try to dilute it in that sense. And as a result, you overhydrate the brain because that water is free to flow between the two and it's not being kept out by sodium outside. So it really doesn't have much sodium inside the brain to go out. It's actually water going into the brain. And so we can expand the brain cells, and that's not good for the brain as well. So we get symptoms depending on whether we are dehydrating or overhydrating the brain when it comes to sodium. Okay. All right, so we have patients with hypo and hypernatremia with too much sodium. So how do we take care and treat to bring them back into the 135 to 145 range? So we have to, again, go back to our dealing with water versus sodium and figure out how do we alter which one, how can we alter those to make this change and come back into normal range. So if we have hyper, we're too high of sodium, we either need to increase our water or we need to decrease our sodium. So ways that we will increase our water is that we will give IV fluids. That will help dilute. And we have to make sure that they don't have sodium in them. So we have to make sure that there are fluids that have like D5W. And so we want to decrease. Sometimes we can put smaller amounts of sodium, half normal saline, things that are diluted. So we want hypotonic solutions over here. And we want to correct slowly. And why do we want to correct slowly? Because if you remember, we have a brain that's been dehydrated, and so we're trying to get that brain back to hydration and the cells, but you can't do it within a few hours because you could go just the opposite and overhydrate it. So we want to do it slowly, and they say to do it about over 48 hours to do it nice and slow. So sometimes using IV solution of half normal saline may do it slowly, but again, D5W, those that don't have saline in will also help. We just have to make sure that we go at a slower rate. To decrease sodium, we usually talk about a low sodium diet. And so we have to watch what our patients eat. We have to restrict it. We may get dietary involved. There are foods that have sodium more than other foods, and they have to cut down on those. Probably the biggest culprit are your processed foods, processed meats, things that have lots of sodium added into it as preservatives, so we have to watch out. Better to go with kind of the whole grains, whole fruits, things that are more natural to get away from the sodium levels that we have. So that's to help try to treat your patients with your sodium being too high. Now, how do we help treat patients when their sodium is too low? In this case, we either have to decrease their water or we have to work on increasing their sodium. So to decrease their water, we're going to be putting them on fluid restrictions. And we're going to restrict those fluids so they don't overdo it on that. The other thing is that we've got a place in our body that can help us get rid of water, and that's going to be our kidneys. And so we might use diuretics. Probably the big one are your loop diuretics. Now you have to make sure, again, that you've got, that it is a water problem, that you aren't going to suddenly throw this person into some problems with water. But usually, again, this helps us to get the water concentration down. The other thing is that we might have to do on the other side is to increase sodium. It's kind of unusual for us to do this, but we might give them salt pills so they can get salt pills. We can also do it by IV. And if we're talking about it being hypo, we could use our normal saline, which is our 0.9% sodium chloride. That would do it kind of slowly, again, kind of keeping in mind the slowness. We might take it a little bit slow here too in hydrating them. But we also have other concentrations that are steeper amounts of sodium, 3% and 5%, that if we have to do it a little quicker, or we want to, again, not overdo fluids. Sometimes there's a lot more fluid in this 0.9 than there is in 5%. So we might be able to cut down the amount of fluids we have to give them in order to correct it. But these are solutions that can be used to overcome a patient. And then don't forget that we also can include a diet that has some higher sodium in it, and this is the case to increase sodium. So these are the ways that we try to treat patients that have sodium issues. We have to deal with the concentration and altering that concentration, and these are the variety of ways we do it. You do have a sheet in your blackboard that is about electrolytes. It does provide many of the signs and symptoms and other issues we talked about. Please include and look at that for adding the treatment section. And that draws our conclusion about sodium electrolytes.